Thanks, Maria, and good afternoon, everyone. So I'm Andy Hindhaugh. I am Head of Office for the National Emergency Preparedness, Resilience and Response Team in NHS England and NHS Improvement. And for those of you who haven't dealt with EPRR before, at a national level, we are responsible for the coordination of the NHS response to national major incidents. So we run the National Incident Coordination Centre that is in place for the COVID-19 response and will be there for EU exit. We also respond to incidents of national significance, and Lorna mentioned the Novichok incidents in Salisbury and Amesbury. Similarly, the terrorist attacks that have occurred, Westminster Bridge, London Bridge and Manchester, and then other incidents of national significance, such as Ebola, all come through this team. Issues that are escalated through the regional EPRR teams in NHS England, NHS Improvement, would also be escalated through ourselves as well. And we're the conduit for anything being passed into or through the Department of Health and Social Care for when you see COBRA meetings being called for various national incidents. We also produce the National Framework for EPRR across the NHS, and that is the key document that includes debriefing and identifying lessons from those incidents to make sure that the NHS is prepared as it can be for incidents that may affect either at that local, regional or national level. One of the things that Karen raised on her presentation was escalation. The word itself can be seen as failure. And a similar thing goes for identifying lessons. There is that situation almost where you get people not wanting to identify lessons, especially when it comes to sharing those lessons outside of an organisation. And what we try and do within EPRR is break down those barriers to put lessons identified, because a lesson isn't actually learned until it's been identified, actioned and reviewed to ensure that it's built into that process. So part of our framework ensures that those lessons are identified, are picked up through the right structured process, they're captured, they're signed off, they're reviewed, and that is how we disseminate that across to the NHS organisations. Many of you may be aware of the serious incidents framework that is used for patient safety. That's the most commonly used methodology across the NHS for those patient safety incidents. Our methodology is very similar. There will be other methodologies for identifying and learning lessons. The principles will be the same across those, regardless of the method used. If we could move on to the next slide, please. And I will talk about the how we undertake debriefing and the lessons identified process. So this is all about a continuous evaluation and that continuous learning, continuous improvement message that we see across the NHS. If you're picking things up at even a very low level incident, there's going to be learning in there that you can build within your organisations that will be a benefit for those bigger incidents that do occur. It is important, as I say, that those issues are captured, but they're captured within a structured framework. And that they're also actioned as well. So it's not just identifying what occurred, what can be learnt, but it's making sure that they're put into an action form, that they're assigned to someone, and then there's a structured governance process in place to ensure that the relevant follow-ups undertaken. We do look through a formal process for debriefing. It should be undertaken at different time points. I will speak in a couple of slides' time about what we've done in terms of the COVID response and how we've undertaken our lessons learned process through there. It's not just at the end of an incident, because we have this enduring incident with COVID. We've ensured that we reviewed the first wave. We're currently looking at undertaking the review and lessons learned from wave 2. I have colleagues Liam Paul and Anita Kramer who've joined as well, who will be able to answer any questions on the slides regarding our COVID lessons learned. Lessons learned can be taken locally or nationally. Sharing that information that's undertaken is key to that learning across organisations and sharing that information and their systems and processes through local resilience forums, through local health resilience partnerships in terms of emergency preparedness, and able to enable that learning to be gained. So
Andy is calling in from his phone, so I wonder whether we have just temporarily lost him. If you're...
Maria, we just had to dial out. He's going to be dialing back in.
Okay, lovely, thank you. If you're okay to hold for a moment. Whilst technology, as often happens, gets the better of us, doesn't it? Although my technology has certainly improved in the, or use of technology has certainly improved in the last few months, but a way to go.
So we are just going to dial him back in again, Maria.
Okay, lovely, thank you. I think my...
Hello.
Hi Andy, you're back in, it's Maria.
Thank you, Maria. Am I okay to continue?
Absolutely, please do.
Thank you. So as well as that local and national picture, it's also about being open and honest and ensuring that those lessons identified are captured by all involved in the process. I've mentioned sharing those lessons, ensuring that it's not just internally within the organisation or within teams, shared across an organisation, shared across a system, shared nationally as well, and how we go about that within EPRR, I will speak about as well. Moving on to the next slide, and just a breakdown of what we use in EPRR for debriefing. You may have heard of hot debriefs, especially those of you who've worked in an ED environment. So when an incident occurs, a hot debrief is about undertaking the there and then. It's about that immediate debriefing of who was involved in something that's occurred. A lot of it is around making sure that those who've been involved are okay, but it's also about capturing those immediate issues that need to be addressed. There may be health and safety issues, there may be process issues that need to be identified. From our perspective, if we're running an incident coordination centre, we identify something that occurs, we would need to ensure that that system is implemented almost immediately should we have a follow-up incident to address. It's also about making sure that support's available where required. Incidents can affect people in different ways, especially when you're looking from an EPRR perspective or on the front line. People have different responses as to how they personally deal with issues that have arisen through an incident. Then we move into what's known as either a cold or a structured debrief or organisational debrief. It may have been, you may have heard it referred to in the past. That should generally take place 2 weeks after an incident has occurred, or up to a month. That lets the dust settle from an incident, especially when you're looking in an EPRR environment. It allows people to reflect on what they did, how they involved. It just gives them that thinking space to what needs to be reviewed, what worked well, what do we need to have a look into in more detail, and what needs to be reviewed. And then when you move into a structured debrief, there's a process involved that brings all of the parties together. And for those of you who have been involved in the serious incidents frameworks or after action reviews, this will be a similar experience for what occurs there. So if you have an EPRR response, you will recognise some of these aspects. So in terms of a structured debrief, We look at our plans. What was expected to happen within the plans? Was our plan right? What actually occurred? What's the difference? Where are the gaps? We look at what went well, what didn't go so well, what can we do differently, and then what needs to change. Key to all that is ensuring that we've got open discussion to review those processes. It's not about those individuals or the team performance. It's not about the criticism. It's about reviewing the processes that are in place. Because through our incident responses, all people are doing is following processes that have been written into our plans. In terms of that structured debrief, we always say you should leave the hierarchy at the door, that everyone's contribution is welcome. Nobody has a higher say within that structured debriefing process than anyone else. It doesn't matter what band you are, where you are within the organisation, whether you're in the team that was involved or primarily in the incident or outside of that. Everyone has an equal stake in identifying what those initial issues were and the lessons that are identified. We're very aware that people have a different truth. People see things from a different lens, even in the same room. So if you've got an incident coordination centre, we have people who see things differently because of the roles that they're undertaking, because of their business as usual roles, because of what they're contributing, and what element they're responsible for within the incident response as well. And the key thing that we always remind people is that we don't make any assumptions as to how the incident should have been responded to. It's factual based on how that incident occurred, what the facts were, and we frame everything around that. Once that organisational review has taken place, especially from an EPRR perspective, there can be that multi-agency debrief. Within that organisational debrief, you will want to identify things that you want to take across to the multi-agency. So if it's not just a single organisation response, there may be issues, especially as Lorna said, it's about communication. Communication interagency is one of the biggest things that comes up in EPRR incident debriefs. Still to this day, I think going back to the King's Cross fire in the 80s, communications was identified then, and when you look through any incident debrief report now, you will see it's still a common theme. Once that multi-agency debrief has taken place, it may just be across 2 agencies, it may be across a local resilience forum or a local health resilience partnership or a system. There should be a post-incident report produced. That should contain the facts about the incident, how it was responded to, what the action plan is, what the governance structure is for ensuring that the lessons that were identified start to turn into lessons that have been learned, and how they will be reviewed. There should be regular review takes place of those actions, so there should be someone identified to ensure that there's an overarching system and governance in place for identifying and that those actions have been reviewed, especially when it's multi-agency. Moving a little bit more into how we share identified lessons from an EPRR approach, there is a joint organisational learning package. So if you link into EPRR teams within your organisations, they will be able to access this through Resilience Direct. Even if you are not looking to add information on there, there is already information on Resilience Direct that you can read from other incidents, especially major incidents from across the country that have been picked up. If we move on to the 5th slide, just want to pick up a few final points about the COVID-19 response, and these are the themes that we have addressed from our Wave 1 response. As I mentioned, we're moving into Wave 2 shortly. We've looked at the front line and how we've been able to support that. So we've got learning on care for COVID patients, things like the PPE and infection prevention guidance around that. There's innovation around wider NHS services. We have a stronger response now because we've had such a time of this incident to be able to respond and tweak our incident response methodologies. And we also have that improved support to NHS staff who mental health and wellbeing support, staff testing, etc. We've also undertaken our own learning internally, and as I say, Liam and Anita are all on the call. If there are any questions that we want to pick up on those, mindful of the time. Moving on to the next slide, number 6, we've got a few things in there just around how we've undertaken that clinically driven decision making at national level. And then finally, on the last slide, in terms of informing our future incident response plans, we are looking at our EPRR framework for enduring incidents and building that pandemic response into that and other incidents that may have that extended duration of what we've seen over the last certainly 9-10 months. That will also include our escalation protocols for future pandemics, how we redeploy staff and how we've learned from our reservist model for the Incident Coordination Centre. Data and dashboards has been mentioned by previous speakers, and then finally looking at the system-wide planning and delivery across the NHS. And I will leave it there. Thank you very much.